Hey everyone, welcome back to the channel. Today, we are tackling one of the most complex and devastating mental health issues affecting millions worldwide. Addiction, or what we now call substance use disorders. Approximately 20 million Americans struggle with substance use disorders, and globally, hundreds of millions of people are affected by addiction to alcohol, drugs, or other substances. But addiction is far more than just a bad habit or moral failing. It's a complex brain disorder with biological, psychological, and social components. So what exactly causes addiction? How does the brain change with substance use? And most importantly, how can we treat it effectively? Let's dive in. First, let's define what we're talking about. Substance use disorder is the clinical term for what we commonly call addiction. It's a chronic brain disease characterized by compulsive substance seeking and use despite harmful consequences. Whether we're talking about alcohol, opioids, cocaine, methamphetamine, marijuana, prescription medications, or other substances, the underlying mechanisms share common features. The DSM-5, our diagnostic manual, defines substance use disorder based on 11 criteria, including inability to control use, continued use despite problems, tolerance, withdrawal symptoms, and neglecting important activities because of substance use. It's crucial to understand that addiction is not a choice or a moral weakness. No one chooses to become addicted. People might choose to try a substance initially, but addiction involves actual changes in brain structure and function that make quitting incredibly difficult, even when someone desperately wants to stop. The American Medical Association, American Psychiatric Association, and virtually every major medical organization recognize addiction as a disease, not a character flaw. Let's talk about what happens in the brain during addiction. All addictive substances affect the brain's reward system, particularly a pathway called the mesolimbic dopamine system. This reward pathway evolved to reinforce behaviors essential for survival: eating, drinking water, reproduction. When you do something pleasurable or beneficial for survival, your brain releases dopamine in areas like the nucleus accumbens, creating feelings of pleasure and satisfaction. This motivates you to repeat that behavior. Here's the problem. Addictive substances hijack this natural reward system. Drugs like cocaine, methamphetamine, heroin, and alcohol cause massive dopamine surges, far beyond what natural rewards produce. Cocaine, for example, can increase dopamine levels by 300 to 1000% compared to natural rewards. Your brain interprets this as something incredibly important for survival. The problem is that with repeated substance use, the brain adapts. It reduces its natural dopamine production and reduces the number of dopamine receptors. This means you need more of the substance to feel the same effect. That's tolerance. And normal pleasures like food, social interaction, or hobbies become less satisfying because your reward system has been recalibrated to the intense drug-induced dopamine surges. The prefrontal cortex, responsible for decision-making, impulse control, and judgment, also changes with chronic substance use. Brain imaging studies show decreased activity in this region in people with addiction. This impaired executive function makes it harder to resist cravings, think through consequences, or make rational decisions about substance use. The amygdala, involved in stress and negative emotions, becomes hyperactive. This is why people with addiction often use substances to cope with stress, anxiety, or negative feelings. The substance temporarily quiets that overactive stress response. Neuroplasticity, the brain's ability to change and adapt, works against recovery initially. The brain forms strong associations between substance use and environmental cues. Certain people, places, smells, or emotions become powerful triggers that activate cravings even after long periods of abstinence. Someone who used drugs in a particular location might experience intense cravings when they return to that place years later. These conditioned responses are incredibly powerful and contribute to relapse. So what causes someone to develop addiction? There's no single cause. Addiction is multifactorial, involving genetics, environment, psychology, and social factors all interacting together. Let's break down each component. Genetics play a huge role. Family studies consistently show that addiction runs in families. If you have a parent or sibling with substance use disorder, you're at significantly higher risk. Twin studies are particularly revealing. Identical twins who share 100% of their genes have much higher concordance rates for addiction than fraternal twins, who share only 50% of genes. Researchers estimate that genetics account for 40 to 60% of addiction. Vulnerability. This doesn't mean having a genetic predisposition guarantees you'll develop addiction or that lacking genetic risk makes you immune. Genes load the gun, environment pulls the trigger. Scientists have identified numerous genes associated with addiction risk. Some affect how your body metabolizes alcohol or drugs. For example, certain genetic variants affect alcohol metabolism in a way that makes drinking unpleasant, which protects against alcoholism. Other genes influence dopamine receptors, making some people's brains respond more intensely to substances. Genes affecting impulse control, stress response, and mood regulation all influence addiction vulnerability. Environmental factors are equally crucial. Early life experiences profoundly impact addiction risk. Childhood trauma, physical abuse, sexual abuse, emotional abuse, neglect, witnessing domestic violence, dramatically increases the likelihood of later substance use disorders. The CDC's Adverse Childhood Experiences study found that people with 4 or more ACEs were 7 times more likely to consider themselves alcoholics and 5 times more likely to use illicit drugs. Trauma changes brain development, particularly in stress response systems and emotion regulation, creating vulnerability to self-medication with substances. Social environment matters enormously. Growing up in a household where substance use is normalized increases risk. Peer influence, especially during adolescence when the brain is still developing, is powerful. Teenagers are particularly vulnerable because their prefrontal cortex isn't fully developed yet, but their reward system is hypersensitive. This combination makes them more likely to take risks and more sensitive to drugs' rewarding effects. Early initiation of substance use is one of the strongest predictors of later addiction. Someone who starts drinking at age 13 is 4 times more likely to develop alcohol dependence than someone who waits until age 21. Availability and accessibility play obvious roles. You can't become addicted to something you can't access. Communities with high drug availability, whether prescription opioids, methamphetamine, or other substances, see higher rates of addiction. Socioeconomic factors intersect with availability. Poverty, lack of opportunity, unemployment, and hopelessness create environments where substance use becomes appealing and addiction more likely. Psychological factors are critical in understanding addiction vulnerability. Mental health disorders substantially increase addiction risk. Approximately 50% of people with severe mental illness also have substance use disorders. Depression, anxiety disorders, PTSD, bipolar disorder, ADHD, and other conditions frequently co-occur with addiction. This is called dual diagnosis or co-occurring disorders. The relationship is bidirectional and complex. Sometimes mental illness leads to self-medication with substances. Someone with untreated anxiety might drink to calm their nerves. Someone with depression might use stimulants to feel energy and pleasure. But substance use can also trigger or worsen mental health problems. Long-term alcohol use, for example, can cause depression. Marijuana use can trigger psychotic episodes in vulnerable individuals. Personality traits influence addiction vulnerability. High impulsivity, sensation-seeking, poor stress tolerance, and difficulty regulating emotions all increase risk. People who struggle to cope with negative emotions may turn to substances for relief. Those who crave intense experiences might be drawn to drugs' powerful effects. However, it's important to note that addiction affects people of all personality types. There's no single addictive personality. The self-medication hypothesis explains much substance use. People often use substances to cope with difficult feelings, memories, or circumstances. Veterans with PTSD might drink to quiet traumatic memories and hypervigilance. Someone with social anxiety might use alcohol or drugs to feel comfortable in social situations. People experiencing chronic pain might become dependent on prescription opioids. The substance temporarily provides relief, creating powerful reinforcement that encourages continued use even as problems accumulate. Let's talk about specific substance categories and their unique addiction mechanisms. Central nervous system depressants like alcohol, benzodiazepines, and barbiturates work by enhancing GABA, an inhibitory neurotransmitter, while reducing glutamate, an excitatory neurotransmitter. This produces relaxation, reduced anxiety, and sedation. Chronic use leads to dangerous physical dependence. The brain compensates for constant depression of the nervous system by reducing GABA receptors and increasing glutamate. When substance use suddenly stops, this rebound can cause life-threatening withdrawal, seizures, delirium tremens, and even death. This physical dependence, combined with psychological dependence, makes these substances particularly dangerous. Stimulants like cocaine, methamphetamine, and prescription stimulants, Adderall, Ritalin, dramatically increase dopamine and norepinephrine. They produce euphoria, increased energy, focus, and confidence. Methamphetamine is particularly destructive, causing severe damage to dopamine neurons with chronic use. The crash after stimulant use involves profound depression, fatigue, and intense cravings, driving continued use. Long-term stimulant use can cause psychosis, cardiovascular damage, and severe cognitive impairment. Opioids: heroin, fentanyl, oxycodone, hydrocodone, morphine bind to opioid receptors throughout the brain and body, producing powerful pain relief and euphoria. The opioid epidemic has claimed hundreds of thousands of lives in recent years. Opioids are particularly dangerous because tolerance develops rapidly, requiring higher doses for the same effect. The difference between an effective dose and a lethal dose narrows with tolerance. Fentanyl, which is 50 to 100 times stronger than morphine, has made the opioid crisis even deadlier because tiny amounts can cause fatal overdoses. Cannabis affects cannabinoid receptors throughout the brain. While marijuana is less acutely dangerous than many substances, it can certainly be addictive. Approximately 9% of people who use marijuana develop dependence, rising to 17% for those who start in adolescence and 25 to 50% for daily users. Heavy, long-term use is associated with cognitive impairments, motivational problems, and in vulnerable individuals, mental health issues including psychosis. The progression from initial use to addiction typically follows predictable stages, though not everyone progresses through all stages. Initial use might be experimental, social, or medical, like prescription pain medication. Continued use becomes regular, weekly or daily substance use that hasn't yet caused major problems. Problem use emerges when consequences appear: missing work or school, relationship conflicts, financial issues, health problems. But the person continues using despite these consequences. Dependence involves both physical and psychological components. Physical dependence means your body has adapted to the substance's presence and experiences withdrawal symptoms without it. Psychological dependence means you feel you need the substance to function, cope, or feel normal. Addiction is the most severe form, characterized by compulsive use despite devastating consequences, inability to quit despite wanting to, and life revolving around obtaining and using the substance. Relapse is unfortunately common in addiction recovery. Approximately 40 to 60% of people in recovery experience relapse at some point. It's important to understand that relapse doesn't mean treatment failed or the person lacks willpower. Addiction causes long-lasting brain changes that make relapse likely, without ongoing support and treatment. Common relapse triggers include stress, exposure to people or places associated with past use, negative emotional states, physical pain, celebrating positive events, and overconfidence. I can just use once. The good news is that addiction is treatable. Like other chronic diseases, diabetes, hypertension, asthma, addiction requires ongoing management, but people absolutely can and do recover. Effective treatment typically involves multiple components. Detoxification is often the first step, allowing the body to clear the substance while managing withdrawal symptoms safely. Detox alone isn't treatment. It just stabilizes someone physically so they can engage in actual treatment. For alcohol and benzodiazepines, medical detox is essential because withdrawal can be life-threatening. For opioids, medication-assisted detox using buprenorphine or methadone can significantly reduce withdrawal discomfort. Behavioral therapies are the cornerstone of addiction treatment. Cognitive behavioral therapy helps identify triggers, develop coping skills, change thought patterns that support substance use, and prevent relapse. Motivational interviewing helps people find internal motivation to change by exploring ambivalence and building commitment. Contingency management provides tangible rewards for staying abstinent, leveraging the reward system toward recovery. Family therapy addresses family dynamics that might contribute to substance use and helps families support recovery effectively. Medication-assisted treatment is highly effective for opioid and alcohol use disorders. For opioid addiction, methadone, buprenorphine, Suboxone, and naltrexone significantly improve outcomes. These medications reduce cravings, prevent withdrawal, and block opioids' euphoric effects. Research consistently shows that MATI dramatically reduces overdose death, improves treatment retention, and supports long-term recovery. For alcohol use disorder, naltrexone, acamprosate, and disulfiram help reduce cravings and prevent relapse. Residential treatment programs provide intensive, structured environments away from triggers and substances. These programs typically last 30 to 90 days and include individual therapy, group therapy, education, and skill building. Outpatient programs allow people to live at home while attending treatment sessions several times weekly. Intensive outpatient programs provide structure while maintaining some normal life activities. 12-step programs like Alcoholics Anonymous and Narcotics Anonymous provide peer support, structure, and community. While not for everyone, many people find tremendous value in the fellowship, sponsorship, and spiritual elements of 12-step recovery. Smart Recovery offers an alternative, science-based, mutual support approach using cognitive behavioral techniques. Addressing co-occurring mental health disorders is essential. Integrated treatment that addresses both addiction and mental illness simultaneously produces better outcomes than treating either condition alone. Someone with depression and alcohol use disorder needs treatment for both conditions. Long-term recovery support is crucial because addiction is a chronic condition requiring ongoing management. Sober living homes, continued counseling, support groups, and recovery coaching help maintain gains after formal treatment ends. Prevention is equally important as treatment. Evidence-based prevention programs target risk factors and strengthen protective factors. Quality early childhood education, parenting programs, school-based prevention curricula, and community-level interventions all reduce substance use and addiction rates. Reducing stigma is critical for prevention and treatment. Stigma prevents people from seeking help, reduces funding for treatment and research, and perpetuates harmful myths about addiction. Language matters. Calling someone an addict or alcoholic reduces them to their disease. Person-first language. Person with substance use disorder recognizes their humanity beyond their illness. It's important to understand recovery is possible. Millions of people are in long-term recovery from addiction, living healthy, productive, meaningful lives. Recovery doesn't always mean complete abstinence forever, though that's the goal and right path for many. Recovery means improved health, functioning, and quality of life. For loved ones of people struggling with addiction, your role is difficult but important. Educate yourself about addiction as a disease, not a choice or moral failing. Set and maintain healthy boundaries. You can offer support without enabling destructive behavior. Take care of your own mental health. Consider support groups like Al-Anon or Nar-Anon for families. Encourage treatment, but understand you can't force someone into recovery. They have to want it. Celebrate progress while understanding setbacks are part of the recovery process. In conclusion, addiction is a complex brain disease caused by the interaction of genetic vulnerability, environmental factors, psychological influences, and social circumstances. No single factor causes addiction, and no single treatment works for everyone. But we understand addiction far better than ever before. We have effective treatments, and recovery is absolutely achievable. If you or someone you love is struggling with substance use, reach out for help. SAMHSA's national helpline 1-800-662-4357 provides free, confidential, 24/7 information and referrals. Treatment works, recovery happens, and there is hope. If this video helped you understand addiction better, please give it a thumbs up and share it with someone who might benefit. Subscribe to our channel for more mental health content. Drop a comment sharing your thoughts or experiences. Remember, addiction is a disease, not a choice, and recovery is possible. Thanks for watching, and take care of yourselves.